let's talk about another case where we're getting relief from bloating symptoms using the GI1 powder. This is a 44-year-old female and originally told me that she was having constipation, she was having upper GI pain, and she was having lower GI gassy bloating. She had tried gluten-free diet, grain-free diet, low FODMAP diet, low acidic diet, carnivore diet, and nothing really changed her symptoms. She had had testing done. She'd had a normal colonoscopy, a normal endoscopy, and a normal abdominal CT scan, and her H. pylori levels were also normal. She had a positive breath test for SIBO. It was hydrogen positive. She took rifaximins, ifaxin, herbals, metronidazole, and then repeated the course of rifaximin, but it didn't really help either time. And her symptoms persisted. So then when I saw her, and really what I'm after here is I'm after the bloating, right? And sometimes that's abdominal pain as well, but I find that abdominal pain is oftentimes more food that people are eating. So she was at her, let's see, 2 teaspoons, so that would be 20-gram dose. 20-gram dose? No, that'd be a 10-gram dose. And she noticed that her bowels were moving better, her abdominal pain was better, and she was less bloated, but having more gas passing. That's like the balloon deflating, right? When it has to go somewhere. So less bloating, more gas passing, that's good. And then when she got to the full dose and held it for 8 weeks, she reported that excessive gas and bloating were entirely gone. So now we're working on expanding her diet back out to see which foods she can tolerate at this point. And if she can't tolerate a food because it causes abdominal pain or any symptoms, I'm going to want her to stay off of it to avoid any kind of regression of those symptoms. She had a follow-up SIBO test, and the breath test was normal. So there's a piece of evidence that we're actually doing some work with the microbiome using this powder to resolve some of those fermentation species that are causing bloating and gassy symptoms.